Hi, I'm Pratibha Shastri here from Innofest. And as you know, Silicon Valley has invented for the first billion. And I think, now Indians are inventing for the next 6 billion. It's also about, not just our own country, but for everybody else. Like I said, the next 6 billion. And it's also in the space technology and various others, including healthcare. And we have Ginny here from Bempu. Hi. Thank you so much for joining us.
Thank you so much for having me.
Yeah. Tell me a little bit about yourself first, Ginny.
Okay, so I'm originally from the States. I'm from Arizona. And I studied in India during my undergraduate. I was looking at access to reproductive health care, the intersection of health and human rights. Was in Delhi, was in northern India, and really fell in love with the work that I was doing out here. I loved how easy it was to communicate certain parts of health and really see how health education played out and how people really took ownership of their health. So after graduating, I was awarded a Clinton Fellowship, and I moved out to Gujarat. I was in Kutch for a year, developing public health interventions for women, for occupational work, and for preventative health care. And after I finished my fellowship, I started working for Bempu Health.
So it's been a year since you've been with Bempu?
Yes, yeah.
What exactly do you do at Bempu?
So at Bempu, I'm the Director of Impact. So I do public health and partnerships. Any of the clinical studies that we have going on, I'll help design the protocols, I'll carry out the studies, get all the data back, do the analysis, to really show the impact of Bempu on a clinical side and on a social side. So we can see how many lives Bempu has saved, how many lives we've protected, how many mothers we've educated and empowered, how much we've increased skin-to-skin contact between mother and child, and different impact indicators.
Maybe it's time to talk about what Bempu is all about.
So let me take one out. So it's just a simple little bracelet for newborns. So every year there are 27 million babies born in India. 1/3 of those will be low birth weight. Low birth weight babies are very susceptible to hypothermia. They don't have enough fat on their body to make sure that they stay warm. And it's important to stay warm because that's how your organs grow, that's how you gain weight, that's how you become a healthy baby. So many babies were getting cold, they weren't able to grow properly, and it's one of the leading causes of death in low-income countries like India. So we spent about a year in the field here. We spent a year in the field meeting with different doctors, trying to figure out what the real problems were in healthcare out here. And doctors were saying that so many babies become hypothermic. Babies go home, they don't know what happens, and they come back sick, but they come back dead. And so they wanted to do something that monitored hypothermia in the home and in low resource settings. So we developed this very simple, easy-to-use bracelet. When a baby gets cold, it flashes an orange light and an alarm. So caregivers know to do kangaroo care, skin-to-skin contact, or swaddle the baby. And if the baby's at a healthy temperature, it'll just blink the blue light every 30 seconds, just so you know if your baby's okay. So once the baby is warm again, the alarm will stop. If the alarm keeps going, it's usually a sign of infection. Infection is another leading cause.
So if the alarm is continuously going on even after the baby is swaddled or held close.
Right.
Okay. Just to understand, hypothermia is because the baby is prematurely born, or are there other?
So hypothermia is preterm babies are low birth weight. Babies don't have enough fat on their body to keep them warm. They have so much skin and they don't have any fat. They don't have everything that they need to thermoregulate, to monitor their own temperature. We're grown, we have everything on us, we can keep our bodies warm, but when a baby comes out, we don't have that, we don't have a tissue in their skin to monitor their own temperature.
And now, this is distributed through what channels?
So we sell directly on our website, bempu.com, and we sell on Amazon. And then we also have distributors throughout India and throughout the world. So we have been in about 150 pharmacies throughout India. We also recently expanded into Nigeria and Ethiopia, and we're still growing. We have a lot of interest in Africa. We have partners out there who are getting our bracelet out to different countries. So
you mentioned, if the alarm is ringing consistently, do you also provide, maybe the mother doesn't know any better and she reaches out to you, do you provide there?
So in Vancouver, that actually happened. The bracelet was going off all night, and the mother called us on the number.
Okay, there's a number. Okay.
Yeah, we have a 24-hour toll-free call line.
Sure.
They called us, and we took him to the hospital, and the baby had a gastro infection. We were able to save that baby's life. So yeah, the mother didn't know what was going on. She was keeping the baby warm. The previous baby had passed away from pneumonia from an infection. And so the alarm was going off. She didn't know what to do, and we took the baby to the hospital.
Okay. I mean, the innovation is so important actually. Also, just could you explain to us as to
See here, it's just like 1 milliliter. There's a little thermostat right there.
yeah.
So that will directly touch the baby's wrist, and that will monitor the temperature. Inside of this band, we have, so as soon as this temperature drops, we're able to monitor that through this.
Okay.
And if it drops for more than 5 minutes, we'll set an alarm. And if the temperature continues to drop at a drastic rate, we'll alarm more. So we have a monitor here, and we also have a thermometer. So we know if the big bracelet's off and it's cold, it's not going to alarm. It's if there's a difference between this temperature.
And I mean, how are you spreading awareness? Especially in the rural areas, which is where I think this is largely needed.
Yeah. So we have partnered with Innofest Bempu, with the Wish Foundation in Rajasthan, a couple other great organizations, and we're really working on education materials. So building posters to go in the NICUs, in the healthcare centers that just says, what is hypothermia? So the nurses know the temperature, they know the risk factors, everything's going on, and they can tell the parents during discharge. So we're also working on different discharge sheets for parents, so they know to do kangaroo care. They know and they know to make sure that their baby is warm and what hypothermia is.
And I mean, what was the motivation behind starting this kind of product?
So our founder, Rahul, he spent a year in the field. He went to over 100 different neonatologists and pediatricians to find out what the real problems were in newborn health. And he had a list of all of the issues that doctors were facing. And then he brainstormed to really work with doctors to solve problems they were seeing. And every doctor said hypothermia was an issue. And when we came up with this idea, doctors wanted it. They're like, yes, I need this in my practice. So it was really a collaborative idea between doctors and India and investors.
This is not just in India, that is distributed in other countries too.
It is distributed in other countries, yeah. We're in Nigeria, India.
Good luck with that.
Yeah.
Thank you so much for joining us.
Thank you. Thank you so much.
As you can see, if you have a newborn in your home, you need to have Bempu too. Thank you.
Thank you.